Malaysia has gone into a strict nationwide lockdown as coronavirus infections rise. It's the latest country in Southeast Asia to strengthen restrictions as more transmissible variants of the virus sweep the region and vaccination rates remain low. While only essential businesses are open, most schools have been closed and people can only go out for necessities. Malaysia has reported more than 7,000 new infections in just the past 24 hours, and deaths that occurred in just the last month make up almost half of the country's official death toll. We'll hear some reaction from Malaysians to the restrictions imposed.
I think even with the new restrictions, the airports are still open, so there's still a potential that COVID can spread while people are struggling under the lockdown.
The lockdown has been imposed too late. For me, it should have been imposed during Ramadan, when there were fewer cases and people didn't move around as much.
Well, our Southeast Asia correspondent Jonathan Head sent us this update.
Well, Malaysians are wearily contemplating going back to the very strict lockdown they experienced in the early weeks of the pandemic last year. It means that, to all intents and purposes, all public life is shut down, shopping malls are shut. People can only leave their homes if they have to, just 2 people at a time, and they cannot travel more than 10 kilometres from those homes. There will be police roadblocks, 800 of them around the country, enforcing these very strict movement control orders. It's bound to have a bad effect on the economy. It's a step the government in Malaysia did not want to take. They had been hoping for something of an economic rebound after seeing the economy shrink by 5.5% last year. But they are dealing with COVID case numbers going up much faster than they experienced last year. To give you an idea, by the end of last year, total COVID cases had reached just over 100,000 in Malaysia in 9 months. They've gone up now to well over 500,000 in just the first 5 months of this year. For the first time last month, they experienced more than 1,000 deaths. This is a trend that is worrying. Even though Malaysia has a relatively well-resourced health system, its intensive care units are now near capacity. And what's worrying people is how long will this lockdown last? It's supposed to be for 2 weeks, but no one knows, given the much higher infection rates now, whether those 2 weeks will be enough. But overhanging what Malaysia is going through is a much bigger problem, which is that it cannot get enough vaccines to get enough of its population vaccinated. So far, it's only vaccinated 3.5% of the population fully, around 6% with 1 dose. And even that's much better than neighbours like Thailand and Vietnam, which have barely begun vaccinating. A lot of that is simply because, like so many countries, you just can't buy enough vaccine. The Malaysians have been buying from many different sources. This whole region had far fewer infections last year than most of the rest of the world. Here in Thailand and in Vietnam, they did remarkably well at containing COVID, at getting case numbers down almost to zero, and they assumed they had more time. They too are seeing very rapid increases in COVID infections now, and they're having to build up their vaccine programs as fast as they can.